Thank you so much for joining us for the morning session of Day 3 of the AHI Leadership Summit. This is our 12th annual summit and the first ever virtual event. My name is Nancy Gildersleeve, and I am the Executive Director of DSRP Operations and the Fulton Population Health Network at AHI. On behalf of our CEO, Eric Burton, our Board of Directors, and the staff at AHI, I am proud to welcome you to the Rural Health Champion Award ceremony. Before we begin, I'd like to thank our sponsors who have supported this event over the past years. We could not have done this without your ongoing partnership and support. Just wanted to share a little bit about the history of the Rural Health Champion Awards. Since 1987, AHI has been an independent nonprofit organization supporting hospitals, physician practices, behavioral health providers, community-based organizations, patients, and others in our region by sharing the vision and mission of transforming healthcare and improving population health. For the past 6 years, the Adirondack Rural Health Network, many of you know as ARHN, our longest running program at AHI, has asked the region to nominate individuals that exemplify selfless, community-minded, can-do spirit that prevails in rural America. This year, ARHN sought to identify individuals who showed altruism, leadership, and continued delivery of outstanding care in the community during these unprecedented times. I'd like to congratulate our 2020 Rural Health Champions. Our first champion is our 2020 Hospital Rural Health Champion, Angela Bashaw, Director of Programs and Practice Support at Alice Hyde Medical Center. I'd like to read a highlight from her nomination. As a sole rural hospital, we are always searching for ways to meet the varieties of mandates placed on us with shrinking reimbursements. The concept of conversions to rural health clinic status was introduced to us several years ago by Angie Bashaw, and she took the lead on this transformation project. She researched and learned the process that the change required and has led transformation in our 4 community health centers and recently our adult primary care center to RHC status. This effort was tremendous as it allowed us, a small organization, to continue to provide quality care and have funds to meet mandates and reinvest in our future needs. Angie's leadership in this conversion is one example of the many projects and initiatives for which she represents at our facility. Angie was nominated by Emily Campbell and Kelly Beach. And I'd like to take a minute to turn it over to Angie to say a few words.
Good morning. First of all, I'd like to thank Adirondack Health Institute for this award. You all have been a tremendous support to me and to Alice Hyde Medical Center in many, many different ways over the last several years. Secondly, I'd like to thank Emily Campbell and Kelly Beach for the nomination. I'm so proud to be a part of our amazing team. The transition to Rural Health Clinic certification was an important step identified by Alice Hyde administration and allows us to continue to provide high quality care to our family and our neighbors in our rural communities. Our phase 1 transition included our 4 health centers that are physically located in the communities surrounding Malone. They were certified in April of 2019. Phase 2 was the certification of the primary care practices in Malone. We received certification with a perfect survey in the midst of COVID in May this year. Our success in the Rural Health Clinic certification process took many people, including several hospital support departments. That included pharmacy, lab, environmental services, and emergency preparedness. It truly was a team effort. Additionally, the dedication and care that our providers and practice staff give our patients day in and day out. In the midst of caring for those patients, they always step up to do the extra things that I ask of them. As the way we provide healthcare changes at a head-spinning pace, they are really the rural health champions. Thank you.
Thank you so much, Angie, and congratulations again.
Thank you.
Our next champion is our 2020 Community Empowerment Rural Health Champion, Marco DiGirolamo, Program Manager at Senior Planet Older Adults Technology Services. Marco was nominated by Jamie Sutton, and a highlight from his nomination is, I believe Marco should be nominated because of his exemplary leadership at Senior Planet North Country during COVID-19 pandemic. Marco worked with Cornell Cooperative Extension of Clinton County to ensure that their collaborative exercise classes continued during this time. These classes have amassed over 700 older adults from all across the region. With doing all of this, Marco has remained a humble and magnificent leader to all of the Senior Planet North Country team. Marco, if you'd like to say a few words, we'll unmute your line.
Sure. Good morning, everyone. I want to start off by congratulating my fellow award winners. I know with the unprecedented obstacles that the COVID-19 pandemic has brought upon all of us, it's definitely been a challenge navigating what is the right way and what is the wrong way of doing things. And I believe that receiving this award is a true testament to all the hard work that each and every one of us has put into our field of work and the leadership that we all exemplify. So I'm honored to be amongst this group of rural champions. I want to also take a moment to thank Adirondack Health Institute for giving me the honor of being a rural health champion, and also thank my colleagues, especially my nominator, Jamie Sutton. None of this work that we've been doing over the last 6 months would have been possible without all of your support. The challenges that COVID-19 has placed upon all of us is something that we could have never imagined in a million years. And it's been an honor of a lifetime to be at the forefront of life-changing programming that impacts not only the physical health, but the mental health of a key group of people who are the most vulnerable to the pandemic, older adults. Not only are they the most vulnerable to the COVID-19 virus, but they are also the most vulnerable to social isolation. And as we have seen, due to the social impact of the pandemic, social isolation has become much, much worse. Having served thousands of older adults through collaborations with local organizations, such as the Cornell Cooperative Extension of Clinton County, to provide our virtual fitness courses, and also offering our own in-house virtual lectures about telehealth, online food shopping, social media, and much more. It's really been amazing to see how North Country older adults have prospered and will continue to prosper for years to come. As I mentioned earlier, it's truly been one of the most gratifying experiences I've ever had, and I would like to once again congratulate my fellow award recipients.
Thank you so much, Marco. Again, congratulations.
Thank you.
Our next champion is our 2020 Transformation Rural Health Champion, Jacqueline Foster, Director of Outpatient Services at 820 River Street, the Baywood Center. Jackie was nominated by Jennifer Nyfield, and some highlights from her nomination are: before the word pandemic was used to describe COVID, Jackie was already researching ways in which the Baywood Center could continue to provide services. Jackie's understanding of the disease of addiction knew that continuing care was a necessity and addictive behaviors was looming, and she wanted to be proactive before the statistics increased. Jackie spent endless hours in the evening working reports, rewriting policies, finding solutions to every hurdle that she encountered so that our services were never interrupted. Client care has always been Jackie's primary focus throughout her 11 years within this agency. She never disappoints. She goes above and beyond. She sacrifices her family time and never complains. What a treasure we all have in our midst. Congratulations, Jackie. We'd like to turn it over to you to say a few words.
Thank you, Nancy. I also want to congratulate the other nominees and thank the support that we always get from the AHI team. I'd also like to thank the team that I work with at the Baywood Center and 820 River Street. I definitely get that can-do attitude from them. It's contagious. If any of you know Jennifer Nyfield, you know she never says no to anything. And I have taken on a similar approach nowadays. So I really appreciate everything that AHI is able to do to support us to be able to say yes to most things. And I certainly think COVID was definitely a challenge, but we've always kept clients in the forefront of our mind and making sure that they're taken care of. And that's all that really matters at the end of the day. So whether it's, 7 o'clock in the morning or 9 o'clock at night, we're working on it. And it's not just me, it's the entire team at the Baywood Center and at 820 River Street. So, while I might be winning this award, it's certainly their work that allows me to be able to sit here today. Thank you.
Thank you, Jackie. Again, congratulations. Our next champion is our 2020 Advocacy Rural Health Champion, Rebecca Leahy, President and CEO of North Country Home Services. Becky was nominated by Donna Beal from Mercy Care for the Adirondacks. And some highlights from her nomination are: Becky began her 34-year career in home health care after 17 years as a registered nurse, working for 7 years in a hospital and 10 years in College Health Services. She has been an active advocate for access to quality home care in our rural region. Becky is an active member of the Tri-Lakes Aging in Place Task Force and the Caregiving Working Group of Essex and Franklin counties, facilitated by Mercy Care, where she is a leading advocate for promoting the aim of the Home Care Workforce Shortage Crisis campaign in the Adirondacks. She is a bold and innovative leader in pursuing new opportunities to recruit, retain, and value home care personnel. Congratulations, Becky. We'd like to turn it over to you at this time to say a few words.
Thank you very much, Nancy. Congratulations to all the award winners. I'm very honored to accept this award. I want to thank Donna Beal for the nomination, and the Adirondack Health Institute and the Adirondack Rural Health Network for selecting me this year. The Rural Health Champion Award means a great deal to me, not just for the recognition, although that's pretty special, but because of what these awards represent. Working in home health care for the past 33 years, I have seen many challenges, and I have seen many challenges and faced many challenges. Healthcare providers in northeastern New York's remote rural regions face many obstacles, and my experience has taught me that rural providers must be proactive and persistent in their efforts to assure access to care. My advocacy efforts over the past several years have focused on the workforce shortage of paraprofessional, home health, and personal care aides. Home care aides are critical to the entire healthcare system, and without an adequate workforce of well-trained and certified aides, patients cannot be cared for and supported in their homes. There are many reasons for the shortage of home care aides, but we all know that one of the main reasons is low wages because of inadequate reimbursement rates. And I feel that's a result of the fact that there has been a general lack of recognition of the home care aide's value to the entire continuum of care. Home care aides have been undervalued for far too long. The best way to change that is for us to tell our stories. We should tell the stories of patients and their families who have benefited from the care of an aide, but we also need to tell the stories of our patients and families who have been adversely affected by the workforce shortage. There is not always an aide available, and the shortage is only getting worse. We need to find solutions, and so our work must continue. I am only one of many who are working on solutions, and there are far too many, even though I'd like to, there are far too many to thank today because time does not allow. But I do want to thank Mercy Care for the Adirondacks Caregiving Task Force, spearheaded by Donna Beal, Becky Prevey, and Maria Alvarez. That little grassroots started in a small meeting room in Saranac Lake, and it's now statewide. And it's been immensely helpful towards our efforts. I also want to thank my board, North Country Home Services Board of Directors, and our staff for their advocacy and their support, and especially our home health care aides, who are on the front lines every day, traveling the remote roads of the North Country, over mountains and many back dirt roads, providing the much needed and compassionate care to our clients. I really want to share this award with them. Thank you.
Thank you, Becky, and congratulations again. And finally, our 2020 Public Health Champion is Dr. Erica Mahoney, Director of Public Health at the Hamilton County Public Health. Erica was nominated by Julie Wolf, and I'd like to read some highlights from her nomination. Erica Mahoney's drive and passion for the well-being of Hamilton County residents has always been evident. Often working nights and weekends, Erica has collaborated with multiple stakeholders to ensure the safety and welfare of residents and employees throughout the county. Despite the chaos and the stress of this pandemic, Erica comes to work each day with a positive attitude, ready for what the day may bring with her team that she has enabled at the Public Health Department. Erica continues to create a safe and stable work environment where her door is always open. This positive energy and positive leadership serves as an example for her staff and for the communities as well. Congratulations, Erica. We'd like to open the line for you to say a few words.
Good morning, everybody, and I just want to say thank you for this award to AHI and the Adirondack Rural Health Network. I also would like to share this award with the rest of my staff here. COVID really started hitting us here in Hamilton County in March. We have 0 hospitals. We have 0 real good, strong health systems here. We have 3 primary care offices. So our ability to combat COVID was really limited from the start. So we've really changed things in our office. We have a home health agency, and they've been able to maintain seeing patients and going out in the field despite the chaos and the stress with the pandemic. But then also the public health staff here, we've started doing our own testing right here at the office, which has put tremendous stress on the office. The contact tracing that we've had to do, there's just been so many changes, and I really want to congratulate my staff for all of the work that they've been doing, because without them, I wouldn't be receiving this award. So I would just want to say thank you to all my staff. I really feel like it was a joint collaboration between not just our department here, but the other departments within the county and the Board of Supervisors. So I want to say thank you to the Board of Supervisors for always giving support. There really was a lot of teamwork. There's a lot of passion within this department to really go out in the communities and try to fight COVID and really keep things as normal as possible. And now that we're seeing the schools reopening, every day just brings different challenges. It's like a roller coaster. Some days are really calm, but others are really busy. And I just want to thank all of my staff for just working with me and continuing to put in the hard work and the effort to get us through COVID. We do have really good numbers, and we're really excited about that. We just want to keep it that way. And all the teamwork has really been wonderful, especially from the top all the way to the bottom. So just thank you, everybody, for this award, and I'm really excited.
All right, congratulations, Erica. Thank you so much. So as we approach our National Rural Health Day in November, we will continue to celebrate our rural health champions. One of the ways that we'll do this is we've created an advertisement that will be displayed on social media outlets, including Facebook, Twitter, and LinkedIn. We will also have our ad featured on the ARHN webpage on the HI website. And we will have a news release that will be sent out to the local news outlets announcing the Rural Health Champions in November. So again, thank you all for joining us today. Congratulations again to our 2020 Rural Health Champions. Have a good day, everyone.
Congratulations.
Congratulations. Take care.